Hello, good morning. How are you guys, everybody? This is Dr. Mwinga Chokwe, mental health specialist based in Ambalale House, Mombasa. Good morning, wherever you are. Hamjambo, mko namna gani? Mko salama, mmeamkaje, mmeshindaje? Nam, let me take this very brief opportunity to just say jumbo to all my listeners, and in particular this month of May, which the Kenya Psychiatric Association has designated as Mental Health Awareness Week. Today is just to sensitize you to the possibility of there being a mental health issue within yourself, within the community, within the family, and indeed within the corporate world, at the place of work, and in the nation at large. You've seen a lot of things happening across the country, and some of the things that are happening which are social or antisocial can be traced back to mental health challenges. Mental health itself is not necessarily mental illness, it's a state of health, state of your mind, state of your emotions, a state of relationships between people and within the community and within the nation. All those fall under the ambit of mental health. So when we talk of mental health, we're really not talking about mental illness. We are talking health. We are talking about total health. Indeed, somebody has said that without mental health, there is no health. In other words, health is not complete unless you introduce a component of mental health in the care, in the discussion. I've seen a lot of hospitals and a lot of institutions talking of health in exclusion of mental health, and now that is a mistake, because research has shown that up to 40% of people going to hospitals for general illnesses, for general checkups, they have a mental health issue related to their physical disorder, which they may be carrying either in acute form or in a chronic form. More so in the chronic form, where you tend to have other issues mentally, for example, chronic diseases like diabetes, hypertension, and nowadays cancer, which is quite rampant, apparently due to changes of our lifestyles. We have a lot of cancer being discovered. It's almost an epidemic, really, because in those days, in my training days when I was in medical school, it was rare to get a patient with cancer. Now we are not only getting patients with cancer, but we are getting young patients, young people having cancer. Now all those chronic diseases, they carry with them a mental health component. And that mental health component is not only for the particular client or particular patient, but also it transcends borders and goes and affects the whole family. Family becomes also involved in that condition of the patient, and they end up also needing counseling. So when you look at a patient who comes to you in the ward, in the clinic, you need to think about the family. What are they thinking? What are their feelings? Are they okay with it? Are they scared? Do they think of the unknown? Especially in African, we always talk about the fear of the unknown. All right? Kurogwa, witchcraft. And you have to talk to them and tell them this has nothing to do with the witchcraft. This is a disease disorder and it affects many across the nation, and your loved one is just one of them. So that they can have confidence and they can manage that patient, especially when the patient is eventually discharged, with the necessary care without fear or whatever. Same thing happens in the schools when there is a lot of stress in the school. You see school disturbances happening, schools being burnt. All those comes down to a mental health issue. So we need to look at the mental health aspects of our lives, our relationships, how we grow, our emotions, how we relate. Remember, we all normally talk about the broken down culture, the culture which we had of respect, where the young respected the old. Nowadays, there's no respect. There's no culture. There's no growth in the young people, and therefore they grow like trees who are independent, and they're easily agitated. They easily take to the streets. They easily abuse, and they can do anything. This we have seen happening in this country, in schools where schools have been burnt. We've seen in the country where there have been demonstrations. Demonstrations are not bad, but then when they are violent, then that means there's something wrong within our mental health system and cultural system. All this breakdown of culture, norms, respect, eventually lead us to have a mental health challenge. So, how are you relating at home? Are you relating at work? And by the way, when we mention work, we have a problem here because a lot of corporates, a lot of companies are still to embrace the new Mental Health Act, which demands that there is respect for the basic human right in workers. That is, workers are not victimized for being mentally sick. Mentally sick means including alcohol and drugs abuse. Those we call them addictions, and they are part and parcel of mental health, which can be and should be addressed, not condemned. And don't condemn the people, condemn the act, but love the people. So these challenges in the corporates, in the homes, in the country itself needs to up their game. They need to grow tolerance. The political wing has to tolerate divergent ideas, because when you don't tolerate, you also raise tensions, you also raise opportunities for mental health disorder. So you can see mental health is more than just a mentally sick person, a confused person, a disoriented person. No, those are the end of the spectrum. But the tail end of the spectrum, you have those who actually need custodial care, they need admission in a hospital, they need treatment, they need injections and so on. But the other end of the spectrum is you and me, the people walking on the streets. About 10 to 11% of us walking in the streets who have mental health issues, and therefore we need to address them. In short, take care of yourself, eat properly, have a balanced diet, stop relying on too much meat, go vegetarian as much as possible, walk a lot, take spices where possible, and generally get involved in core curricular activities that, other than your own profession, that will brighten your mind and expand your relationship with us. Okay, we don't want to take much more time. This is enough for today. Have a good mental health week. Be careful, be cheerful, and don't worry, be happy, for everything gonna be alright. So sang Bob Marley. Cheers. Thank you. We'll see you again. Thank you, Dr. Mwinga Chokwe.